So the question is, should we abandon all vaginal deliveries and allow cesarean section? So why this conversation when many of us are talking about reducing the cesarean section rate is the question. So also there are a lot of discussions on the women's right to choose cesarean section. And it's interesting to note that Royal College of Midwives had asked the England hospitals to abandon normal birth targets. And RCOG also had given the opinion that women giving birth should feel supported and their choices should be respected. The RCOG does not support one method of birth over another. So in this context, and also in our part, there is a lot of rising litigations against doctors and a lot of violence, and doctors having a mental agony, and we know that less and less doctors are opting to practice obstetrics. And with all the unpredictabilities of vaginal delivery, less and less obstetricians, less and less gynecologists are practicing pushing for vaginal birth actually. So the question is, there are a lot of questions for you, madam, and with your experience, why you think that women are asking for cesarean section? And when we stress on the positive aspect of vaginal delivery, are there any negatives? And what are the evidences against the negative aspects of cesarean delivery? And we know that there are a lot of unpredictabilities about the vaginal delivery, and does previous birth injury or shoulder dystocia in our experience affect the decision making of the doctors? So how should we be counseling our women? This is the question. Madam, please can you?
I'm sure it sounds quite paradoxical that immediately after someone talked about Robson's classification and auditing cesarean sections in every institution, and especially in an era when many of us, including Dr. Piley, are giving talks on how to reduce cesarean section rates, that we are talking about is vaginal delivery, and after Noser spoke so much about instrumental deliveries. I mean, why am I even discussing this? And I'm sure that's what many here are thinking. But we cannot run away from the fact that there are women who do opt for an elective cesarean section, even low-risk primary gravid women. You could call it cesarean section on demand, cesarean section on maternal request, whatever it is. And it is happening. If you think that it's only happening overseas, please remember that India also has a strata of people who certainly are free thinking, and therefore do ask for or demand cesarean section even for their first pregnancy. So Shamima has asked me a whole lot of questions all together, not even one after the other, and let me see how I can answer them. What we need to remember is that there are two major components to this particular question. One is the woman, I don't want to call her a patient, the woman who is asking for cesarean section. So we need to understand why is she asking for this, and then of course on the other side are we, the caregivers or the obstetricians, and what do and how do we feel about it, and these are two issues to be looked at. So the important question, I'll take up the woman's issue, and her points of view first. Why do women avoid vaginal birth? It could be because of the downside of the vaginal birth, meaning they have heard reports about birth asphyxia, maternal injuries, perinatal and intrapartum deaths, a fear of vaginal delivery, whatever aspect of vaginal delivery it may be, but there could be a real fear. The need to be in control, right of freedom to choose, experience of the others from which they are talking, whose especially negative experience, and of course a whole lot of discussion in the media about every small incident that takes place, especially with respect to vaginal birth. So if you look at fear, it could be fear of labor pains, it could be fear of the neonatal outcome, It could be fear of maternal injuries like a pelvic organ prolapse or urinary incontinence that can happen later. It could be a previous negative experience, and I think one of the most important aspects here is a disrespectful care. And I know that all of us have been talking again and again about this respectful maternity care, and if the woman has had a disrespectful care in the previous pregnancy, it can be a very big motivating factor for her to ask for a cesarean section. Next time, pain in labor, which was inadequately controlled. If she had not received good pain control, analgesia during previous labor, of course we all know the pain in labor pain is one of the worst, and she can be quite dissatisfied and ask for this. Any complications that she could have suffered from, like an instrumental delivery, I wouldn't call it a complication, but a mode, of course, of delivery, perineal lacerations, shoulder dystocia, or even a HIE in the neonate. So the balance between the benefit and the harm of vaginal birth and cesarean section is crucial. You need to look at the good and bad of both. So what do we have to say in favor of vaginal? All of us, I'm sure any obstetrician when asked will say vaginal birth is the best. We have been brought up to believe by our parents, by the society, and by teachers that vaginal birth is the best thing that can happen to you. It is the most accepted, safe, time-tested, natural, ethical route of delivery in uncomplicated pregnancy is what all of us would say. That there is no surgical car, there is less post-operative pain, duration of hospital stay shorter, no anesthetic complications. But there are negatives which we certainly have to remember, which may be an instrumental delivery, which the woman looks upon as a negative thing. Emergency cesarean section may be required. Intrapartum complications can occur. Vaginal perineal injuries can occur, and long-term sequelae are quite known. Normal delivery is a retrospective diagnosis. And none of us can ever guarantee a woman that you come to me and I'll give you 100% vaginal normal delivery with an absolutely healthy baby and with no trauma to any part of your anatomy. This is not possible to guarantee. But remember, cesarean section has its advantages as well. So the woman will turn around and ask you, I have the control, I can make a decision. There are no intrapartum complications that you people are listing. There are no labor pain. There's no disrespectful care, no pelvic floor injuries, and later problems thereof. On the other hand, maternal morbidity associated with cesarean section, all of us know the list: anesthetic complications, surgical complication, long-term complications. Now all of us are talking about adhesions, incisional hernias, scar dehiscence, placenta accreta, and of course scar ectopic pregnancy. And fetal complications like TTN are certainly known. So now we have the pros and cons here. Do we really know which is better? Do we have a randomized controlled trial taking adequate sample size of uncomplicated pregnancies, low-risk pregnancies, and comparing them, randomizing them to active cesarean section versus vaginal birth to compare which is better? We don't, and it would be unethical to do this. And so there are no randomized trials, and complications of C-section are biased by the medical and obstetric problems for which they are done. We have data from term breach trial and also data from planned cesarean section that have been done in several countries, and they all show that there is no increase in the maternal mortality, and the increase in morbidity are very minimal. And because of the recent advances in anesthetic technology, cesarean section technology, I mean, these complications are certainly small, and women are, when explained that this is the rate of complication to be anticipated, many women are unwilling because to actually put up with the discomfort that may follow a normal delivery. So women's involvement in healthcare decisions are very important. They want to decide which color dress they want to wear from the age of 5. They want to decide how many holes there should be in their t-shirts and pants and wear. And they want to, of course, be involved in decisions on antenatal screening, labor analgesia, and episiotomy, breastfeeding. So why not decide on the mode of delivery is the question they are asking. And can we really say no? But then what should the physician or obstetrician do? I need an extra minute or two, Preeti. The question is, are we convinced that vaginal birth is better? Are you worried about the litigation? We talked about it in great detail. shouldn't we be considering the violence? And you want to sit through, convince somebody who doesn't want to have a vaginal delivery and then sit through all this and face all the problems? Do we believe that we become technicians and that what happens to our obstetric skills and decision making and all our training if you're going to listen to the woman and say, okay, I will do a cesarean section just because you complicated questions. And there was a survey done in BMC Pregnancy Childbirth published in 2019 where they had actually asked this question to the obstetricians, to the public, to the patient, and they have done in several countries, and they found that a large percentage of obstetricians think it is women's right. Even large percentage of obstetricians, even when they say it is the woman's right, are a little unwilling to perform the section. 30 to 40% of general public agreed that maternal cesarean section on maternal request is actually good, and some women said, percentage of women said yes, it is our right, but they still want to go by what the obstetrician said. So the opinions are varied widely between the countries. The issue is extremely complex. There are no guidelines, and it is not even possible to have guidelines. If we as obstetricians and caregivers believe that vaginal birth is safer, better, and we are more comfortable with it, the reason why the woman opts for section must be addressed. Respectful care in labor room and positive childbirth experience go a long way in convincing women. And of course, justification for vaginal delivery includes all the pluses, and you need to inform them about the long-term complications of cesarean section, going home on the third day, the cost not being very different, the immediate problems, not by inadequate analgesia and pain relief for the post-operative pain. These are not the important matters, but they need to know what are the long-term sequelae. So repeated